Good evening to all. I am Dr. Shobhusachi Das, child specialist. Today I am making a video after a long time to focus on a topic which has scared everyone right now, particularly in pediatric age group. All the parents are very conscious, all the parents are very frightened about the news that are coming regarding the adenovirus. So first I would divide my talk in 3 or 4 questions. First question is that I am getting from all the parents are whether any cold, cough, fever that is occurring in children right now are all adenovirus. So the answer to the question is yes. Nearly 60% of all the cases that are coming at present in this month of March, particularly in the age group ranging from 2 to 10, 11, 12 years, particularly school going children, all we are considering as adenovirus positive patients. But there are other virus also that are circulating in the environment, like this flu virus, this respiratory syncytial virus or RSV virus, metapneumovirus and others. So yes, unless proved otherwise, in this epidemic period when we are facing many patients coming with cold, cough and fever, with red eyes, with choked throat associated with vomiting, loose motion, cough and cold, high fever at 102, 103, maybe higher than 104 fever lasting for more than 4-5 days. All these cases may be adenovirus positive. Now coming to the second question, why this adenovirus is so important and how is it different from other viruses that are causing similar kind of fever, cold and cough? The answer to this question is that adenovirus has a tendency to cause viral pneumonia. It can cause damage to the lung, leading to respiratory failure. If this respiratory failure sets in, then you have to admit the child in a hospital. He may require oxygen therapy, he may require high flow oxygen therapy. Some machines like high flow oxygen therapy, CPAP, BiPAP and sometimes mechanical ventilation may be required to treat such patients with adenovirus who are facing respiratory failure. Now that is the danger part of this adenovirus. Now the third question is that how common is this complication? This complication is not that common. Although we are getting so many patients with adenovirus being diagnosed with fever, cold, cough, unremitting fever, coughing for like 7 days, 10 days, but very rarely, only very few children go on to develop this complication of respiratory distress, that is breathing difficulty. The child may have difficulty in breathing. Child breathes heavily, like when you see this symptom that the child is breathing heavily, the child is having problem in breathing, then only you have to get cautious and maybe arrange for admission in a hospital. Now when we have to admit a child in a hospital, usually he will require some kind of respiratory support like high flow nasal cannula or CPAP or mechanical ventilation, and in that case a PICU or ICU bed is required. Now we all know that ICU beds for pediatric patients are very limited in any city. So if many children develop this complication, there may be a scarcity of this bed. And in such a situation, when your child is having this distress but we are not getting a bed to admit the child to give this oxygen therapy, at that point it is dangerous, because therapy of adenovirus, if you can admit in a ICU and start this high flow nasal cannula or this CPAP early in the stage of the disease, usually gets better within 3-4 days. So that is the danger of adenovirus, although rarely, but it can cause damage to the lung, leading to respiratory failure and requiring hospitalization and oxygen therapy, specialized oxygen therapy, specialized respiratory care therapy. That is the problem. Now coming to the fourth question, what is the treatment of adenovirus? Is there any specific treatment available? The answer is no. Like any other virus or like COVID virus, there is no specific antiviral medicine that we can give to the baby to kill the virus that has entered into the body. So what we can do, we can support the baby in whatever problem the baby is having, like giving proper nutrition, proper fluids, rest, and symptomatic therapy like fever medicines, cold medicines, cough medicines, and whenever required, oxygen or high flow oxygen or respiratory support. That is the hospital part. So usually when you are getting children with high fever and suspecting them of adenovirus, usually the treatment can be done well at home with paracetamol, with cold medicine, with cough medicine, and lots of fluids. The child has to be well hydrated. In rare occasions when there is respiratory distress, we have to admit the child and give some respiratory support. But there is no role of antibiotic, there is no role of any antiviral. The body will take care of the virus with time. We have to be patient and monitor the child whether he is having any problem in breathing or not. In 99% of cases, the child will recover without any specific medication, with just rest, lots of fluids, good nutrition, medicine for fever, medicine for cough, medicine for cold. Now fifth, there are certain problems that we are facing with these children. That is the fever. In many children the fever is not coming down, and in some patients the fever is continuing for more than 5 days, 6 days, 7 days, like that. And in some children the cough is not going by 7 days, 10 days, or like that. So these are all problems that we are facing with children with adenovirus, but it is not life threatening. It will go away. A child may be having 104 degree centigrade temperature, 105 degree Fahrenheit temperature, but the child is well off. He is playing, he is going on with his activities, he is running, he is cheerful. So you don't have to be anxious about it. So what can be done? We have to give this paracetamol for this fever and wait. If the fever is not coming down, if it is more than 100 even after giving paracetamol, then we can't repeat this paracetamol before 4 hours. So in that case we can give a sponge bath to the baby with a wet cloth. Just sponge the whole body, maybe once, maybe twice, thrice, whatever times required. That will bring down the temperature gradually. Now some children are having this fever for 4 days, 5 days, 6 days, but with time this fever is coming down. So we have to be patient and we have to give this paracetamol and tape sponging whenever required, and with time this fever will go away. Now second problem that we are having is persistent cough. Some children are having this cough and it is not going away. Even after giving medicine, it is taking like 7 days, 10 days and all this, and maybe more. Sometimes we have to use this nebulizer also. So eventually this cough will go away. You have just to be patient. If the cough is very distressing, we can start some nebulization, and with time it will go away. Only thing that we have to remember is that if the child is having difficulty in breathing, then we have to go to your doctor. You have to go to your doctor and inform that I am feeling that my child is having difficulty in breathing. So now what another problem that is coming, that if the child is having repeated fever, like the fever went away, then it has come back again after 5 or 7 days. It stayed for 2 or 3 days, then it goes away and it comes again after 5 or 7 days. So these repeated fever episodes are coming. This is also something that you should just treat with Calpol and be patient, and it will go away. Now finally the question of prevention. How can we prevent? how can we prevent this? How can we guard our children from this adenovirus? Now, this adenovirus spreads in classrooms. So mainly it is the school which is the culprit. Other crowded places where the children are present together, one child may transmit the virus to the other. So place of transmission is usually the school. And for you adults, you may wear this mask and try to hand wash properly so that you do not contract the disease and bring it to your home and give it to your child. So parents of small children, parents of neonates, you have to be careful. School going children, if you have been informed that there are multiple children who are sick with adenovirus in your school, then maybe not going to school for 7 or 10 days may help. Is there any adenovirus vaccine? No, it is not available. No adenovirus vaccine is available. So it is only this social distancing that will help. And lastly, how will you be sure that it is adenovirus only, and whether every time testing for adenovirus is required or not? So adenovirus testing is quite expensive, and as because we do not have any specific antiviral treatment for treatment of this adenovirus, there is no point in going on testing for this adenovirus when and every time. So if you feel that your child is having difficulty in breathing, then inform your doctor at the earliest. He may then test for adenovirus, and if required hospitalize and give the proper treatment. Finally, I should always impress upon the idea of having a medical insurance for you as well as your children, because in case of any epidemic or in case of an emergency, you may not get a bed in a government hospital and may have to admit in a private hospital. The health costs are going up day by day, so having a health insurance for your whole family is always a very good idea, and you should invest every year on this medical insurance. So thank you. Do not panic. Be informed that it is going on, but in 99% of cases it is just a viral fever. For that 1% of case, you have to be vigilant. You have to know that if there is breathing difficulty in your child, you have to inform your doctor as the earliest and take the necessary steps. That's all. Do not panic. Do not panic. Um, Stay healthy, eat healthy, and drink lots of fluids. Thank you.